Now, a little word on the epidemiology in children. Throughout the pandemic, even in the first 6 months, it was evident that the mortality and morbidity in children is very low, and which has sustained throughout the pandemic. So this is Indian data. Up to 5 years, about 3.3% of all cases were below 5 years, and up to 11 to 20 years were 8.4%. So if you just remember this figure, this about 3.4%, 3.36% in 10 below 10 years and 11 to 28. So totally about 12% of all admissions in hospitals were up till now, up till October 2021, were pediatric admissions. 80% were adults admission, and say, or 90%, almost 90%, 88% were adult admissions, and almost only 12% were children who got admitted. And the same type of pattern is from other countries. I have got data from Canada, Ontario, one of the state of Canada, where again the children comprise 12% of admissions. And comparison with before Delta and after Omicron. So this is, of course, I will explain better in the next slide. So only 0.07% of pediatric age group required ventilation compared to 0.43 in the adult population. Now, that is one thing, that this thing has been well established, that in children up to 20 years, there is a data of a meta-analysis from more than 25 countries earlier on the pandemic only, done by John Ionitz of Stanford University. The survival up to 20 years is 99.9973. So up to 20 years. And whatever children died, they died of comorbidities. A healthy child, it was almost negligible. And even up to 69 years, the survival is 99.5. Infection fatality rate is just 0.5%. And at the population level, it is 0.05% in India. Infection fatality rate is not to be confused with case fatality rate. Case fatality rate are the cases admitted in hospitals. But infection fatality rate is calculated by enlarging the denominator, by extrapolating how many people had faced the virus, because 70-80% of them are asymptomatic. These are done by sero surveys. The last sero survey was done in Delhi. We found 90% of our population in September having the antibodies. Of course, adults in September were started having the vaccine, but more interestingly, 80% of children below 18 years were having the antibodies. That time, child vaccination had not started. So getting that denominator, and if we extrapolate more than before this Delhi survey, all India survey representative sample, about 67% were found to having antibodies. That was somewhere in June. That time, hardly any vaccination coverage was there, 10% or 15%. So that shows that in June only 90 crores Indians were already infected, had faced the virus, and many had recovered. 90 crores were the estimated people who had been infected, many of them asymptomatic or mild. And at that time, the recorded cases, the notified cases were just less than about 3 or 4 crores. So 3-4 crores only were detected up till June 2021, whereas 90 crores had already got the infection. So that shows that with this contact tracing, RT-PCR, and so many things, we could only detect about 5-6% or 10% of the cases. 90% cases go undetected. And infection fatality means that anyway, if the virus is running in the community, how many people what percentage of people will succumb? So since we are a younger population, our infection fatality rate 0.05. Globally, even on the CDC side, at the WHO side, it is 0.3%. We have got this nature's advantage. We are younger population, and we are less obese. And if say other concern in children, it is almost 99.9973. But the other concerns are for which their justification is there for vaccinating children. One justification is whether they suffer, so they hardly suffer, there's hardly any mortality. The second concern is transmission to the elderly. They say, okay, the child will not suffer, but it may bring home and it will infect the elder members. And the third concern is that it may, once you open the schools and the children are not vaccinated, they will spread the community transmission. They will trigger the community outbreak. There have been studies, published studies, which dispels all these concerns. So we'll just go through rapidly. So this is, of course, as I said, the Ontario, that is our country also we saw 12% people, children were infected. So similarly in Canada also 12% out of this. And in Canada, out of in one state of Canada, for which data is available in the public domain, more than 9,255 deaths in adult, and there were only 2 deaths compared to almost 9,000 above deaths in adults. So the child death is very, very, and many children die for so many other causes. Besides this, the second concern is that whether it transmits to adults. So they have done studies. This is published in a pediatric journal by Benjamin and all. So they have done 92% of times the child got the infection from the adults. They have done the contact tracing and they saw okay, only 8% times the child transmit to the adults. So more than 92% times the child gets the infection from the adult. So the child does not transmit. Neither they found any instance of community transmission from children precipitating community level outbreaks. So outliers should not dictate public health policy. For public health policy, you see the big picture. For all practical purposes, the children are not super spreaders. Neither they can precipitate community outbreaks. Similarly, how lethal is the virus? This I have already mentioned. This is the year. Up to 19 years, the survival is 99.9973. And right up to 69 years, it is 99.41. Every day, particularly in our country, we are facing much higher risk. We will see, I have put one table in that. And up to 70 plus, it is 97%. 70 plus with comorbidities, 94%. So if the frail old person, 75, nursing home, he is bedridden, his chance or her chance of dying of COVID is 5%, 6%. But there are again studies done by the same Dr. John Ionitz of Stanford University. At the start of the pandemic, he had published papers saying that those who are bedridden and frail and very old, even a common cold virus kills 8% of times. The mortality from any coronavirus is 8%. So this coronavirus also is behaving more or less in a similar fashion. So this is just one point to keep in mind when making public health policy.